Choosing the health insurance best for you can be challenging and intimidating. Can you afford the premium? How much are doctor's visits? What if the unexpected happens and you're faced with a massive hospital bill? Ready or not, it's time to choose your health benefits, and anyone without an employer has to choose also. Here to help us with all of these decisions is Mike Gatteri with HealthMarkets. Welcome, Mike.
Thank you for having me.
All right, you have 14 years in the insurance industry. You've saved your clients hundreds of thousands over the years. Help us out. Not only Medicare customers, you also help people under 65. It's open enrollment for those folks too, right?
Yes. So open enrollment for anyone under age 65 actually opened yesterday. They have from November 1st through January 31st to pick a new plan. But there are a couple important dates that lie within that open enrollment period. As an example, anyone who wants their plan to needs to be enrolled no later than December 15th. Anyone who wants their plan to start February 1st would need to enroll by January 15th. And again, January 31st is the last day to enroll altogether.
Absolute last day.
Yes.
The end of January. All right, it is understandable the industry has changed a lot. Run us through some of the changes for this upcoming new year.
Well, we are in the third year of healthcare reform. So naturally, as the bill changes and we see continual adaptations by the carriers, this year there are two very distinct things that are happening. Carrier who is raising their rates by as much as 30 to 40%.
Wow.
Many individuals have already started to receive those letters. But the good news is there is also a carrier who is dropping their rates by as much as 30%. So if you are one of those people who got one of those very large rate increases, certainly give us a call. We can help get you onto one of those other plans to keep those rates as low as possible.
All right, it's understandable. A lot of folks get confused between healthcare reform and other options. Can you help explain those?
That is without a doubt the biggest misconception we hear out there. The terms Affordable Care Act, Obamacare, healthcare reform, PPACA. Many people think that these are four different programs with four different types of coverage. They actually mean the exact same thing. So there is a lot of information out there that people need to understand. You can buy a plan today with no pre-existing conditions. So you are covered on day one regardless of your medical status. But I think the biggest thing that people need to be aware of are what are called the government subsidies. You can actually have the government pay a portion of your health insurance for you. Now it's based on your income. So the lower your income, the more help you can qualify from the government. And again, that's where someone should really reach out to a knowledgeable expert to help really look at those options for them.
Like yourself.
Absolutely.
All right, so people are wondering, you mentioned the subsidy, how can we maximize that for us?
So the subsidy is based off what's called your adjusted gross income. And so things like contributing to an IRA or contributing to a health savings account will lower that adjusted gross income. And like we just said, the lower the income, the higher the government subsidy. I actually had one customer who was $200 above that threshold. We had them put just a little bit into a health savings account, which gave them an $8,000 yearly subsidy from the government that they would have otherwise not known about, except we knew what those thresholds were.
Wow. All right, let's talk about that penalty.
Yes.
A lot of people are talking about the fact that if you don't have coverage, you're going to face a fine.
Now, not only is it for not having insurance, but it's for not having a qualified plan. You have to have a program that covers the minimum essential benefits. That penalty to not have a plan continues to go up. Last year, it was 1% of your yearly income. This year, it's 2% of your yearly income. And if someone does not buy a plan in this open enrollment, they will face a 2.5% penalty in their yearly income, which obviously can add up, depending upon your income.
Yeah, absolutely. What should people do if they have questions about their policies?
First thing they should do is they should contact someone like myself. Yes, you can go to healthcare.gov. Yes, you can go directly through the carriers, but someone like myself will know all of the various options. Again, we work with over 180 different companies, and the one thing I'd want to make sure that everyone is aware of is there is never a fee for our services. So I can help someone enroll through healthcare.gov, and there would be no fee to them in order to do so.
Also, you have a best price guarantee, is that right?
Correct. At HealthMarkets, because we are a nationwide company, because we work with over 180 different carriers, we can offer a best price guarantee. And what that means is that we guarantee that we will have the lowest price for any program that we offer and recommend. So again, you can go through healthcare.gov and have someone over the phone help you, or you can have someone local who knows your situation and you're not paying a penny more for it.
Great. And we've got more information on how to get in contact with you on our screen.
Thank you.
Mike, thank you.
No problem.